how do we build in the incremental program shifts where we're able to see the financial value return to the individuals that are participating in the program, our clinical resources that are participating in the program, and of course the patients themselves. We'll talk about how system performance, how we're creating system performance through these initiatives, and how that system performance actually allows us as the clinical delivery organizations to drive the transition from volume to value rather than feeling victimized by getting dragged by a new contract or getting dragged by a new regulatory structure. And finally, it's about taking those operational resources and the compensation models behind them and getting those connected to the risk that we take as a broader organization. So the place that we spend a lot of time talking these days in population health is around the ACO models or the similar ACO models. There are two principal models that we discuss most frequently. There's lots of commercial and private models out there, but the ones that we have the best data about, the public models, are split into the Pioneer Model ACOs and the Medicare Shared Savings Programs. And it's interesting, when we started talking about this, there was a lot of insight. These were backed by demonstration projects like the Physician Group Demonstration Project, where we could see that there was an opportunity to create clinical and financial alignment through programs where more of the risk was at the provider level. So we started with the 32 Pioneer Model ACOs, and over 5 years the intent was to reduce $1.1 billion in cost across those 32 ACOs. At the end of year one, the savings were at $92.2 million, which those are significant savings when you're talking about 32 organizations, but it's less than half of where they'd wanted to be organized over the process of organized over the course of the 5 years. So it goes back, if you look at back in 2011, AMGA sent a letter to Dawn Berwick, who's the CMS administrator, where basically it was saying, look, this is a burdensome program. It's very prescriptive. There's a huge amount of operational cost that's being into it, and there's not enough incentive to really make it worthwhile. And you look at the end of year one, and you'd